overturn the will of the people and the results of the election, that he has, quote, probably worked harder in the last 3 weeks than I ever have in my life. Probably have worked harder in the last 3 weeks than I ever have in my life, which kind of tells you everything you need to know about how devoted he was to being commander-in-chief over the past 4 years. But with just about 6 weeks left in office, there are increasing concerns that Trump may turn into a King Lear type of character on the way out. As one Shakespearean scholar told the New York Times, quote, "We are approaching the end of the play here, and that's always where catastrophe comes." That's where his focus is, as always, solely on himself. And while President-elect Joe Biden is heavily focused on the pandemic, tomorrow his team is set to begin meeting with U.S. military intelligence leaders. We're still 45 days away from this inauguration. It's a lifetime for citizens here and across the country who are struggling medically and financially. As loyal viewers of this show know, I love being out in the field. I love listening, talking to people, much more than I enjoy being behind a desk. And that's why I'm coming to you live every Sunday from places across the country that are feeling the pressure from the most pressing issue of our times, the COVID-19 pandemic and the resulting economic crisis. And I want to hear your stories firsthand, masked face to masked face, at a distance of at least six feet. Last week, you'll remember, we were in South Dakota on the outskirts of the Pine Ridge Reservation to bear witness to the plight of Native Americans during the pandemic and to make sure that their story isn't forgotten, as it so often is. And today I'm in Portland, Oregon, a city like many across the country that is currently struggling medically and economically under the weight of the pandemic. Like most cities in the country, cases, hospitalizations, and deaths are all rising in Oregon and have been for weeks. As you can see on this chart, November has been the deadliest month so far for Oregon. Already in December, the state has reported more deaths than in all of March, April, May, or June. We're only a few days into December. On Friday, Oregon reported records for daily new cases and deaths, the latter of which reached 30 in a day for the first time, which brought the state's death toll to over 1,000. And consider this jump. Oregon reported 20 or more deaths in a day only 5 times before reaching 30 deaths a day. Governor Kate Brown said she was, quote, horrified by these record figures, adding that the state is, quote, on the brink of a full-blown crisis. The Oregon Health Authority reports there are 15 active COVID-19 outbreaks at medical facilities across Oregon, up from 10 locations a week ago. And that includes a whopping 6 in Multnomah County, which is where I am now, home to Portland, Oregon. And to make matters worse, as you can see, hospitalizations are at record highs in Oregon, as are the number of patients on ICUs and ventilators. Look at this chart. In order to slow the spread, Governor Brown enacted a 2-week statewide freeze and included a ban on most non-essential indoor activities, including dining, movie theaters, museums, and gyms. Now, that statewide freeze ended last week, and in its place, beginning Thursday, Governor Brown instituted a restriction framework based on a county's risk level, broken down into 4 categories, and those last 2 weeks. Multnomah County currently resides in Oregon's extreme risk category. In fact, 25 of Oregon's 36 counties are in the extreme risk category, and restrictions are very similar to the recent statewide freeze. Now, this all continues to have a drastic effect on Oregon's economy. The latest job numbers are stark across the nation, but in Oregon, it reveals that more than 15,000 Oregonians filed initial jobless benefit claims during Thanksgiving week. That's nearly 4 times the number of new claims from a month earlier, and it's the highest level since May. And just like cases and deaths, things are only getting worse as we approach what President-elect Biden calls the very dark winter. Joining me now for a first-hand report on what it's like to work on the COVID-19 front lines here in Oregon is Kathy Magure. She's an emergency room charge nurse at Legacy Good Samaritan Medical Center here in Portland. Kathy, thank you for joining us this morning. You're a charge nurse, so you have a slightly different set of responsibilities in which you deal with all of these issues that we've been talking to other nurses about. You kind of have to deal with the mood of the place, the morale of the place, the scheduling for people who are overworked, the fact that you deal with nurses who just need some time to themselves, but they just got to keep coming in and doing what they do day after day after day for 10 months now. Kathy?
Yes, sorry, you were breaking up. Yes, so it is, as a frontline charge nurse, it can take a toll, but we have to remember that we have to take care of each other, and we have to ensure that patient care always comes first, so we don't want to compromise that care. So, but I also feel that since the beginning of COVID, we have kind of come a little bit of a long way. We know what to expect in the emergency nurse. It's flu season, so everybody that walks in with cold-like symptoms, cough, nausea, vomiting, we already will treat them as if they're a COVID positive patient.
So that's the good news. We're more familiar with it. We're good at treating people a little bit better. We may not be short of at least some of the equipment, but one of the differences is that you're used to people who are used to their kind of work. Now you've got to deal with the issue that so many of your colleagues, how are they dealing with the pressure themselves as nurses and as medical professionals?
So as medical professions, we'd like our community to listen to us, believe in science, believe in your healthcare providers. We need to work with each other as a community. So we just make sure we are also taking care of the really sick ones, and we just need to keep on doing what we're doing, which is stay at home, wash our hands, wear your mask, please, and just listen to your healthcare providers.
You are not a COVID outbreak center at Legacy Good Samaritan Medical Center, but there are still concerns across the country that with the number of people who, as you say, are coming in and you're treating them as COVID patients, if they've got any of the symptoms that look like COVID patients, does that present a risk to people who are not COVID patients? In other words, are you yet approaching capacity for your hospital generally, so that people who might have other issues are compromised because of the fact that COVID is taking up so much of the available medical care?
Yes. So that because of the current surge that we are seeing, we end up having, at times it becomes a space issue. So if you're healthy or you don't have any pre-existing conditions that will put you at a higher risk, then the advice is just to see primary provider, stay at home, so we can ensure that we are really taking care of the people that are really, really sick. And that way we can either have space for those people. We are almost there yet, but we are not there quite yet. So our urge as healthcare providers, yes.
No, I'm sorry. I interrupted because we have a bit of a delay, so I didn't know you hadn't finished. I want you to finish your thoughts. I'm sorry about that.
Sorry. No, that's okay. Go ahead, please, Ali.
Well, I just want to thank you for that. I cannot say thank you enough on behalf of our viewers and the nation to you and your fellow nurses and your fellow doctors and your fellow healthcare providers across the country and at Legacy Good Samaritan Medical Center in Portland. We are so grateful for your work in keeping us healthy. Kathy, stay safe, and we will talk again. Kathy Magure is an emergency department charge nurse at Legacy Good Samaritan Medical Center here in Portland, Oregon. Joining me now is the Democratic Representative Earl Blumenour of Oregon. He's a member of the House Ways and Means Committee and a lifelong Portlander. Good to see you, Representative. I normally speak to you about other matters, but now I'm in your town, and I was out yesterday talking to small business people. Look, this is a town that is struggling through Portland, through COVID, and with some remnants of some of the unrest that we saw this summer. You are particularly interested in ways in which this country's restaurants can be helped. Tell us a bit about that.
Absolutely. Thank you, Ali. Well, the restaurant industry was hit harder in terms of unemployment than any other. And these, if you're in Portland, you understand that our neighborhood independent restaurants are really the lifeblood. They employ more women and minorities. It's where people gather. It's very entrepreneurial, and it is sort of the essence of Portland. And across the country, There are 500,000 independent restaurants. They employ over 11 million people. And as I said, they were hit hardest. Early in the year, in April, half the nation's unemployment were at the independent restaurants. We've developed some legislation that would provide direct cash grants to keep these restaurants afloat. You know, a year from now, we'll have the vaccine, we'll be able to return to normal, but we're not going to be able to do that if these vibrant cornerstones of communities large and small are out of business. And if we don't help them, the estimates are 80% will close their doors permanently. So we've got a piece of legislation. It has broad bipartisan support. Half the Senate has signed on. The Democratic leadership in the House has. It was in the HEROES Act that we sent over. And this is an opportunity to keep them alive, not just the independent restaurants, but the whole supply chain. The people who sell fruits and vegetables. You know, this is an opportunity for us to keep them in business rather than going out of business and making the problem worse.
Yeah, I think you make an interesting point. It's a supply chain. So it's not just the small business owner who you may really love and you may really know, but they cause other people to have to sell them stuff, and they employ lots of people. So one of the things that a number of small business owners have been telling me, restaurants and otherwise, is that what we don't need right now is more loans, because they have not been able to do business for the last 10 months in a normal fashion. They're worried they may never pay those loans back. So they either need grants or absolutely interest-free long-term loans. They need the right instrument. It's not just that they need something.
Absolutely, Ali. And so what we see is there's talk about adding to the PPP loans. Those don't work for restaurants. They are highly leveraged. They don't even know if they're going to be in business in 2 months if we don't give them some help. Direct cash grants makes the most sense. And we've done economic analysis that suggests that the $120 billion program that I've introduced and has such broad bipartisan support, it sounds like a lot of money, but it will provide more than twice that overall economic benefit. Keep them paying taxes, paying rent, making the mortgage, the supply chain functioning, rather than having it unravel. This is something that makes sense economically, makes sense in terms of the fabric of the community, and I'm hopeful that as we enter the next stage, that we will get the help for the independent restaurants they deserve. They are amazing addition to our community, but every part of the country, the neighborhood diner or the restaurant that means so much, that we need to keep them at work for us.
Yeah, and restaurants sort of matter all over the country, but when COVID is over, if you haven't been to Portland, people need to come here and understand how central they are to this city's spirits. Before I let you go, Congressman, I want to talk to you about the fact that Portland is associated by a lot of people with this summer's racial injustice movements. You've just been responsible for the Marijuana Opportunity Reinvestment Expungement Act. It's called the MORE Act. And part of what it has to do with is racial injustice and the criminalization of marijuana use. Tell us what you think about that.
Well, you know, this is a stain on America. The so-called war on drugs was directed primarily to people of color, especially young black men, destroyed hundreds of thousands of lives. It was selectively enforced against people of color. They were arrested and cited many times, 3, 4, 5 times more frequently than whites, even though they used it the same. And that can completely unravel their lives. And the irony is that we now know that cannabis is no more harmful than certain substances that are perfectly legal. Tobacco is more addictive and kills more people. We have an opportunity to turn the corner. What I'm proud of is that this is a movement that was led in Oregon and other states around the country to legalize cannabis. It now employs 250,000 people. It's a $17 billion industry. And in Oregon, marijuana sales just topped $1 billion by our having the federal government get out of the way, allow it to be legalized, allow them to have bank accounts and do research, and stop the selective enforcement against people of color. It's a signal for racial justice and for economic reinvestment.
Congressman, good to talk to you as always. Thank you for taking time this early morning here in Oregon. Democratic Congressman Earl Blumenour of Oregon. Thank you, sir.
Thank you so much for being in Portland. We appreciate it.
It's my pleasure. Not long ago, federal agents stormed these very streets in Portland, violently cracking down on protesters, demanding racial justice and an end to police brutality. A summer of strife culminated with the phrase, defund the police. President Obama recently waded into the discussion, and let's just say his view didn't go over so well with some progressives. I'll have more on that from Portland after a quick break.